ಏನಿಲ್ಲ ಆರಾಮಾಗಿ ಇಲ್ಲ ಕೂತ್ಕೊಂಡು ನಾನು ಇಲ್ಲ ಕೂತ್ಕೊಂಡು
Recording in progress.
Good evening, friends.
Please unmute.
Recording stopped. Recording in progress.
Good evening, friends. Today is the sir. Please start the class, sir. Please.
Okay.
Long periods long goal of
So good evening all. Today we will discuss about anti-helix and helix and concha parts. Yesterday we discussed tragus and antitragus, where we are treating the adrenal gland, endocrine gland, and thyroid and brain stem, even hunger points and all. So today we'll go with the vertebrae part. So as we see in the reflex of the ear, so this is the helix. It starts here and goes up the outer part of the ear. Opposite to that, this is your anti-helix. So sacrum, lumbar, thoracic, and cervical. You can see these parts here. AH1, anti-helix 1, 2, 3, 4, 5, 6, 7. So this is the area of your cervical, thoracic, and lumbar area. So above that, the upper part, this is your leg reflex. Anti-helix 18, 17, 16, and 15. So this is representing your leg part. So this is your AH15 is your ankle and heel, and 16 is your sciatic, knee point, and this is the hip joint, and this is the coccyx. So this is going to be a spinal vertebrae and as well as the leg. The other part of this anti-helix outer side, so AH8, 9, 10, this is belongs to the outer side of the helix. Okay, so this again goes with the spinal reflexology concept. So AH8 is your neck point, AH9, 10, 11, so it is going to be your abdomen, chest reflex. All these things comes under helix. So I'll just show you the few of the things. So you can see here, if it is not visible, just text me, I will change the so this is your anti-tragus, which represents the brain and brainstem. From here, the vertebrae starts. So cervical 1, 2, 3, 4, 5, 6, 7 here. Then thoracic. In Chinese medicine reflexology, your vertebrae ends here itself. This area is cervical, thoracic, and lumbar and sacrum. But according to European method, the cervical and thoracic and lumbar starts here and sacrum, and then it is your sympathetic point. So either you are going with the European or Chinese method. The small variations are there, but better to go with the checking the ear color variation, because if any lumbar pain or low back pain is there, you can see the clear changes in the structure of the ear. Maybe color, maybe some blood veins or swelling. Those kind of things you can see in the lumbar area, this area. Okay. Use Sujok Jimmy, that is easy to understand. Okay. So I will show you a few points. Just wait. Your model. Just a minute. Just a minute, I just went to bring the auricular seats. So these are all the seats you can use to activate the particular area. with the Sujok Jimmy. So I will show you the points. Just check it out. This is quite effective for treating lumbar pain and cervical. So all of you can just check this part. This is the area of lumbar. This is the area of thoracic. This is your this is your cervical area. You can check where it is painful. I'll just check the one person sitting beside me. Come here. Okay. So with Sujok Jimmy, you can check this point. This is the cervical, thoracic, and lumbar. Just check where is sensitive point. Oh, you can see their expression. The moment you touch cervical, lumbar is not much, thoracic, and neck area. So can you guess what may be his symptoms? Is the moment I touch is cervical and thoracic is feelings painful. So definitely you may have some neck pain. Is there neck pain? Is there? What is the symptoms? Neck pain. And some low back pain. So you can just have 2 seats. Now it's time 8:10, 8:20. I'll apply the point. And again, we will ask the feedback by 9:50. Fine? Will you do? One is cervical. Another one. Lumbar. You can enjoy the patient suffering and pain. See this? Very clear. See, Then just apply that and tell the patient to just press that point daily 8 to 10 times whenever they feel the pain or when they remember that. He is not enjoying his healing, but you will enjoy the painless situation, the painless moment. Maybe after 1 hour or 1 day, I don't know. But you are doing your job. You are triggering the cervical and lumbar with auricular seat. Shoulder point. Okay. The shoulder point, I will show you. Wait. So this is the area of shoulder. If anybody is having pain in the shoulder, you just apply one seed on the circle which I am showing. This area. This is the shoulder point, just outer side of the helix. Just you can check with your Jimmy where exactly the pain is there, or you can check with your hand itself and apply one seed there. You can see the drastic relief from the pain within few hours. See all these points, it works like your TM points only. I think most of you seen a miraculous results with the TM. The same thing, you can increase your success rate by adding auricular therapy. It's quite simple. The concept of reflex you can use. Along with that, if you have the concept of meridian and energies, you can get still better results. For example, one person asked about the shoulder pain. So one, I will put it for the shoulder. What the supportive point you can put for the shoulder? Anybody? What is the supportive point for the shoulder? See, your shoulder is nourished with your lungs. Not small intestine. Small intestine area is here. Turn that side. This is the small intestine area. Okay. The lungs and large intestine is covering this part. So whenever you treat shoulder, strengthen their lungs. If you strengthen the lungs, automatically the shoulder become broad and strong with strong muscles. So in auricular, you can apply whenever you treat shoulder point, you can use one more point for the lungs. By applying lung point, you can enhance the permanent cure for the shoulder. Clear? And also the cervical and lumbar thoracic which we are using, you can use the concept even for the spinal reflex also. Look at this. This is the spinal reflex which we are using. I'll give you one more. Yeah, that is what I'm telling. Whenever you are treating any problem, combine the knowledge which you learned in TM course and add one more flavor of auricular. So here whenever we treat the spinal cord, we can also treat the vital organs. For example, all of you know that the lumbar is controlled by kidney and cervical is controlled by liver and lungs, and thoracic it's connected with abdomen. So all of you know the spinal reflexology. So you can keep one seed for the spinal reflex. For example, I'll give you simple example. If urine inconsistency is there or sciatica pain is there, so the kidney which is connected with the lumbar. So whenever I treat lumbar, I also treat the kidney. Whenever I treat kidney meridian, I also treat the lumbar. This is how you should combine the points. So for example, if you are treating acidity or gastritis, obviously you cover the point of spleen and stomach when you're treating your digestion issues. Your spleen and stomach is connected with the thoracic. Thoracic 6, 7, 8. So whenever you treat digestion disorder, you also check the point. Definitely there is you can find out the painful point on the thoracic area here. So by treating the vital organ along with the spinal reflexor of that organ, you will get good results. So if you want, I will show you a spinal reflex one.
Sir, you're muted, sir.
Madam.
Okay, now it's clear, sir.
I'll just open. Just a minute. Is it visible? The spinal reflex which I'm showing. Check this. Is it visible? Yes. So the same spinal reflex you can correlate with the ear. The spinal reflex which you are checking the ear, you can treat ear. For example, if anybody treating the throat infection, so that time you can also activate the cervical. When you are treating thyroid, you can activate cervical. When you are treating the digestive disorder, you can treat with the lower thoracic. Upper thoracic is connected with the lungs and heart. So this is a simple as spinal reflex, which we are correlating with the auricular. It's similar to same correlation which you do in the Sujok also, no? Will you do the same? So here in Sujok, you are activating the spinal reflex in the finger. The same thing we are doing here. So wherever you are treating any of the vital organs or any of the symptoms or any of the Sanjio points or 0 point and all, in the insect method, what you are doing, the same thing you can do it in the auricular. Clear? If a sciatica pain is there, you can treat this area just below the triangular fossa. This is lumbar. This is the hip joint. Just put one circle there. This is the hip joint point. And above one, we are using for as a Shenman point to reduce the hang energy. We are using that. We will discuss that one about later. This is about hip joint, and this is the sciatica pain we are using here. And above that is the sympathetic nerve relief. Even sympathetic point also you can use whenever you want to give relief to mind and nervous system. Clear? So this is the area of buttocks, incision, and sciatic nerve as shown in the picture. So just combine a sciatica nerve. There's a three different nerves which passes the sciatica. Out of that, which we are using, this is the area 82 and 81. Normally, we are getting a sciatica nerve for three different meridians. One is urinary bladder, another one is gallbladder, and another one is the spleen. You can just check the few images in the these things which covers the sciatica. Whenever you treat sciatica point, don't forget to treat your urinary bladder, gallbladder, or spleen. How to decide which point to be treated? Along with point number 81. How you are deciding along with auricular, which point you treat? Just ask the patient about the pain path. So it is going along the urinary bladder, or it is covering the gallbladder, or it is going inside the thigh and covering the spleen. Depending upon that, you can use sciatica point. Along with the sciatica point, you use 1 point for urinary bladder. Even though they are suffering a sciatica quite long years also, that you can solve within 2 to 3 weeks. We've seen a number of results with the sciatica. But the concept is whenever you treat sciatica, you should treat the lumbar, because due to lumbar compression only the sciatica nerve is getting compressed. One is lumbar, the second one is sciatica, third one is urinary bladder or gallbladder or spleen. Okay. For calf muscle pain, you can treat the calf muscle reflex here. I will show you the reflex of the spinal cord, which is anti-iliac curse, which is going into the leg one. So if you are asking about heel pain, ankle pain, knee pain, and hip joint, so all these things which covers in the superior part of the anti-iliacs. Anti-iliacs, superior curse, it is just above the lumbar and coccyx, this area. So if you are having calf muscle pain, just check it out, where exactly the pain the patient is suffering. So this is the calf muscle point, you can activate. Or if his heel point, heel pain is there or ankle pain is there, so by using Sujok Jimmy, check the patient. Is any color changes in the skin or is it painful? So hip, ankle and heel, all these things you can treat here. Clear? Knee point, this is the middle of the superior curse, that is your knee area. Any doubts to treat hip, ankle, knees and heel? So these are all the points just representing. This is the a pictorial representation and this is the numerical representation. Clear? So anti-iliac superior curse and anti-iliac point we can use, and another one is anti-iliac outer side. So this is the outer side of the anti-iliac. This is anti-iliac. On the anti-iliac we are treating the lumbar, sacrum, thoracic and cervical, just outer side of it. So here which you are treating for upper back, the breast area, just it is a spinal reflex. Okay, the thoracic which is connecting with the chest and abdomen. This area we can treat upper back and abdominal pain, and as well as the breast cyst and all. Even this area which also covers the thyroid also. We can use this outer side point to treat the spinal reflex nerves which is covering the body. So I hope you can treat the spinal reflex, all these things. Anti-iliac superior curse and anti-iliac outer side, all these things. Now there's one more important area which we are using in here is triangular fossa. This is the area of triangular fossa, is divided into 8 different parts, just subdivided into TF 1, 2, 3, 4, 5, 6, 7, 8. Totally 8 divisions. Okay. In that, thoracic, the triangular fossa 1, which we are using for Shenman. So Shenman is a very important point in the auricular, which we are using to sedate excess yang, physically or emotionally. For example, stress, anxiety, fear, restlessness, insomnia, and even the patient suffering hyperactive, unable to sleep. So all excess yang symptoms is treated with the Shenman. Okay. So TF2, just below that, triangular fossa 2 is for hip joint. So many people suffering with the sciatica, hip related issues that you can cover here in thoracic 2, in triangular fossa 2. In TF3, which is a hepatitis point. So if you are suffering with hepatitis B or C or any liver disorder, you can treat this. TF1 is a stop wheezing point. When you are suffering with wheezing and you are trying to treat with a different lung point, if they are not getting relief, along with lungs, you can also use TF4. It's a stop wheezing point. Who are suffering with wheezing, you can check the middle of the triangular fossa. Definitely they are feeling some sensitive pain. Just activate with the seed and you can see the grip changes. And TF5 and TF4, it's also used for antihistamine point. So it antihistamine drugs we are using to relieve from the allergies. So any dust allergy or any wheezing, all those things you can treat with this TF4. Then TF5, which is we are using for constipation. There is another point which we are using in the helix. It's the helix 3. So helix 3 comes here, that we are discussing later. So along with the TF5, helix 3 together, it is giving wonderful results for the constipation. Especially people are spending more time in the toilet, and it's a hard stools. So any incomplete bowel and gastritis can be treated with the thoracic TF5 and helix 3 together. TF5 itself gives the result. You can use both. Then TF6, the end of this, your anti-helix, just below that, it is the IBP point. Okay. TF7, just below that, it is your uterus in the ladies and prostate gland in the men's. And sympathetic automatic point is TF8. So a person feeling stressful, anxiety, and nervousness, nervous disorders, Parkinson, all nerve-related issues, you can activate the sympathetic nerve. Not only that, even the stagnated chi, which is causing mood swings and stress. For all those things, you can use triangular fossa 8. So most of the times in triangular fossa, we use Shenman, IPP, and third important is uterus and prostate. So if anybody feeling endometrial thickness of uterus, or in the gents, if there's incomplete urination or urine inconsistency, all those things you can treat with the triangular fossa 7. Clear? So it is a small area, but which is covering the maximum points, totally 8 points, and which are used, all 8 points which we are using for different purpose. Clear? So after triangular fossa, the second is scaphoid fossa. It's called SF. In SF, it is a reflex of hand. You can see this. It starts here and it ends here. This entire arm reflex is here. So shoulder, master shoulder point, and arm, elbow, wrist, and fingers. In the palm area, we are also using, it's a liver yang point, also allergic point. This is the SF. It starts 33, 34, which is thyroid and nephritis, and shoulder. Like that it goes till the fingers. So this you can treat SF 1, 2, 3, 4, 5, 6 divisions. The first one, SF1, is shoulder dislocation or shoulder point or frozen shoulder, and all you can do. And SF2 you can use for shoulder joint as well as insomnia. If any sleep disorders, you can use this. And SF3 is the arm. Arm means from the shoulder to the elbow. That is SF3. And SF4, and another point you can use along with this is SF5, you can use for skin disorders like urticaria and skin rashes, itching, all those things you can use. All SF1 to SF6 also used for the pain. So any body pain, joint pain is the suffering. Then just any point we are using two things. One is helix 6, it is called omega 2 point, and another one is which are using for the SF point. So all SF point, it is not only clearing the hand related issues, it is also clears the pain. This is in between the helix and the anti-helix. Clear, I think. See, for ear seed application, it's better to apply for week, and you can change the points after 1 week. It is not like TM points which gives the results in 10 minutes. 10 minutes, there you are applying for the meridian points. That's quite effective. Here, in the ear, you're not using meridian points, you're using the reflex points. When you're applying on the reflex, you should keep it for the long time. Clear? There's a one more point. This is your the main area, Chamber Concha. This is the inner ear, inside the ear, this area, which covers all your vital organs, your stomach and pancreas, liver, kidney, uterus, bladder, stomach, belly, and intestine, small intestine, large intestine. So all this is your lower geo, this is your middle geo, and this is your upper geo. So which covers all the abdominal points and below navel points. Duodenum, small intestine, large intestine, all. Similarly, this is superior concha. In the inferior concha, it is your where your heart, the chest area and digestion system will be there. So superior concha and inferior concha, it is also called cavum concha. It is a thoracic cavity which is covering the heart, sangio, and nervous point and thalamus, and also it's covered thyroid and brainstem. This is lungs and heart. In the superior side, this is your lower side. Upper lungs and lower lungs. In the Chaimba concha, it is covering your abdomen as well as lower abdomen points. Clear? That I can show you here the same points. This is quite real image. You can understand better. Needles you can do once a week or twice a week. Here the spleen point is little inside. I will correct that. This is the spleen area. All are in right position. The only thing is, your spleen is went little inside. You can correct that. This is the spleen. Around the heart, this is your pericardium. The gray circle which you are seeing, that is around the heart is pericardium, and below that is the lungs, and this is sangio. Below sangio, there is the endocrine gland. That you can see this here. Just below that, this is sangio. Below that is the endocrine. So all concha, what inner ear, which is covering the vital part of your body. Clear? And one more thing you can use, the concept of chakras. If you're a yoga master, already having the awareness of your chakras and functions and the area covering. So that is where the helix 2 and helix 3 ends. That is your root chakra. Your Shenmen, it's your sacral chakra. And your stomach point, which you are using, that is your solar plexus. And the liver point, which you are using opposite to that, it's a spleen, it's a heart chakra. And cervical point is your throat chakra. And your endocrine gland is your third eye. And below that is a crown chakra. So it is similar to the endocrine glands which we are using. Look at this. This is the heart point or Shenmen. This is your sacral. Opposite to that is a root chakra. And this is your throat. Okay. And below that is a mind, is your crown chakra. So all 7 chakras you can activate with the auricular. 0 point is your stomach point only. That we are using to tonify. If anybody is having yang deficiency, excess coldness symptoms, then we use 0 point. 0 point is a tonification point. And Senmen is a sedation. If anybody is having excess energy, excess heat, then excess yang, we are using Shenmen. Clear? Before going to the practicals, along with this, one more thing you need to know. That is the lobe. So lobe is divided into 9 points. Here, it is covering entire face and 8 points. Look at this. The 11, the lobe 1, which is related to tooth. Lobe 2, it is the tongue disorders. And lobe 3 is your jaw points. If anybody is having jaw-related pain, you can treat 1-3 or lobe 3, 13. So 14 is your teeth point, lower teeth points, and 15 is quite oftenly we are using for eye disorders like eyesight or eye inflammation, eye blurriness, floaters, all glaucoma. Along with the liver, you can use the point number 15 or it's a lobe 5. And lobes 16, 17 is the inner ear. Yesterday, a few people are asking about the tinnitus. So that tinnitus point which you are using for ear, lobe 6. Okay. So insomnia, we are using point number 20. The same point of upper tooth you can use for sleep disorders. Just above that, it's a low BP point that you can use for the blood pressure variation. Look at this. The interior ear, it's connected with the helix 5. This, it is called lobe 6. Lobe 6, we're activating for ear disorders. It may be tinnitus or ear block. Okay. Lobe 5 is eye disorders. And lobe 2 is tongue. And lobe 8 is we are using for tonsillitis. So this lobe you can use to treat vision disorders, brain, and as well as the sleep problems, teeth, and ear. Clear? This is the lobe. And around the helices, this already we discussed. This stomach, this is a digestive tract around the helices. Mouth, esophagus, stomach, duodenum, small intestine, large intestine. Just it comes around the helices where you are telling the 0 point. If acid reflux is there, esophagus and hiccups, all those things you can treat here. Okay, this is Kaum Kuncha. So one more is the helix, the outermost ear part. and it's quite oftenly used for allergy related issues. That is the 60. It is also called helix 7. So this point which you are using for allergy, and the point number 58 we are using for constipation and hemorrhoids, and 59 which we are using for allergic cold and all, and 57 and 58 it is the lower portion of the rectum, means which we are using for sexual disorders and libido, to increase libido, to reduce libido and to increase sexual attraction. We are doing 56 and 58. Opposite to that, 64. 64, it will reduce the sexual desire. 56 is increasing the sexual desire, and 60, which you are using for anti-allergic point, and 59 we are using for common cold and cough. And this is in between 60 and 59, there's a omega 2 point, which are used as a pain relieving point. So when you're designing any protocol, you can design the multiple points as shown in the picture. For example, if you're treating headache, one, you can treat the Shenmen. As I told, anything excessive pain, excessive emotional expression, or stress, the first point which we treat is Shenmen. Then if the forehead headache or temple headache is there, you can treat below 3 points. And to relieve a nervous system, we're using the sympathetic nerve point. That is just beside the sciatica, the end of this. Okay. This is dizziness. Again, most of the time, dizziness is missing the direction. Means who is controlling the direction in your body? It's your liver, which controls the biological time and as well as the direction of the tissues. So if you miss the direction, like dizziness or while sleeping, while walk, or ligament tear, all these things is a directional issues only. So for directional issues, treat liver and kidney, which you are treating, because giddiness may happens sometimes with the blood deficiency or excessive liver yang. So kidney is required to raise the yin energy to counter affect the pitta. And sometimes vertigo also happens with the ear imbalance. So that time you can use the internal ear point. So either you can use all 5. If sure that giddiness due to liver blood deficiency or liver yang, then only liver and Shenman point is enough. Okay. If the ear imbalance is there, then you can use the internal ear point. If you have any doubts related to the protocol designing, you can ask. Yeah, you can treat 2-3 disorders at a time. Omega 2 point, which you are using to reduce the pain. It is called battlefield acupuncture point. Is that just below this tip here? This is helix 6 that you can use for the battlefield acupuncture point to reduce the pain in the body. You can raise your hand so that I can unmute. Yes, Shirish Kumar.
गुड इवनिंग सर.
Yes.
सर टोन या सेडेट करने के लिए डिफरेंट कुछ यूज लेना पड़ेगा इसको पॉइंट के लिए?
For what?
कोई भी पॉइंट ट्रीट करने के लिए टोन या सेडेट करना पड़ेगा या उसके लिए क्या करना पड़ेगा?
No, it depends on your whether it is a yang deficiency or in excess. So I will share you this PPT to tell you better way. So we are using some few primary points and secondary points. So these are all the quite oftenly used point. See, finally, to treat auricular, these points are enough. First, locate properly all 12 major organs, which we learned all based on TCM. The second one, 7 chakras. The third one, primary points, which most usually used. In this sympathetic point, which we are using for nervous relaxation, Shenmen we are using to reduce the excess yang symptoms. And 0 point we are using to tonify the yang. If you are low symptoms are there and yang deficiency is there, in excess is there, then to tonify it, you are using the 0 point. Another one is adrenal gland, quite oftenly used primary point because it is controlling your hunger and as well as it is controlling the adrenaline, and in that it is controlling the all allergies and infections. And why endocrine gland is important means this is controlling all hormones in the body. The another one is tapasthema. It is quite most famous and most effective point. ERFX, which you are using for the allergies. Any type of allergy, you can use either skin allergy, nose allergy, cold, cough, all those things, you can use the ERFX. Just beside the ERFX, this is the point of omega-2. This we are using for to reduce the body pain, joint pain, rheumatoid arthritis pain, bone pain, or any pain. Just beside this. Okay.
सर ट्राइजेमिनल न्यूरल्जिया के लिए 13 नंबर यूज किया जा सकता है?
Yeah, you can use sympathetic nerve, which is causing the hyperactive of the nerve sensitivity. Sympathetic nerve, and another one is this jaw pain is there, no? This jaw point.
Yeah, yes.
Yeah, this is a lobe 3 point. You just activate those two along with the liver point because liver is controlling all the momentum in the body.
Okay, thank you, sir.
Thank you. And this is the secondary points. So which we are using for to raise the BP, to reduce the BP, and anger point. And tranquilizer point we are using to reduce the stress. And the liver yang point just above the SF6. So this we are using to reduce the even allergies and the body pain, everything. Okay. So if you want to design anything, you can design in this. All your protocol, you can design with this. Yes, Sitaramadu.
Sir, can we use both ears same points or 1 ear is enough? Sir?
1 year is enough.
1 ear. So another ear, if any another problem, we can fix it both at the same time?
Yes. If the patient is telling multiple symptoms, you can use 2 years.
Okay, sir.
Okay.
Thank you, sir. Thank you.
Yes, Venkatesh.
Sir, due to some fall from heights, generally in rehabilitation, the lower 2 legs will not be having any sensation. They'll be sitting on wheelchair, and with physiotherapy and other things, they'll be able to stand. So for them, how to activate the lower part?
The first point here, you have to do your lumbar area. This is through spinal reflexology, you can connect lumbar with this one. And you can also enhance your leg, thigh joint pain, hip joint pain, plus muscular system enhancement that you can do with the liver. So to enhance muscular system, you can go with liver. For to enhance your nervous system, you can go with the sympathetic point. And through spinal reflexology, you can also activate the lumbar. This is the best thing you can do. Okay. Lakshmi Umesh.
ಹಲೋ
Yes, madam.
ಹಲೋ ಸರ್ ಅದು ಏನ್ ಗೊತ್ತಾ ಬಾಡಿ ಫುಲ್ ಕೋಲ್ಡ್ ಆಗ್ಬಿಡುತ್ತಲ್ಲ ಅವಾಗ ಹೆಂಗ್ ಅದ್ ಹೀಟ್ ಮಾಡೋದು ಬರೀ 0 ಪಾಯಿಂಟ್ ಹಾಕಿದ್ರೆ ಸಾಕ
If you are feeling extreme cold, one you can use 0 point. The other you can use lungs. Because lung is which is responsible for warming the skin and keeping your immune.
Okay.
Another one is Sangio. Yesterday, first day we discussed, no? Sangio is the one which controls all triple warmer water. Just use these 3 points.
So you can't use what is that Shenmen or
No, Shenmen to
reduce yang.
Yes.
Okay.
Okay.
So 0.2 Sangio lungs.
Yes, madam. Thank you.
Okay, thanks.
Yes, Damodar.
So problem is that we can't see a video only.
Video is there, no?
No, nothing is there. Only blank screen is there, but even only sound is there.
No. Video is there. I think just a minute. I will
Sir's video is there. We can see him.
Now you can see.
Spotlight is there now. Spotlight is activated.
Yeah, it was there, sir.
My question was that regarding the dizziness point.
Yes. What?
But it is also on the anti-tragus, no, sir. There is one point between the brainstem and pituitary.
Yes, this is the anti-tragus.
Yeah, between the pituitary and brainstem, there is also dizziness point, no?
Yes. That, just a minute, I will go to the slide. Yes, this is your anti-tragus. Is it visible?
No.
Is the anti-tragus?
Yeah.
Exterior. This is the brainstem and this is the pituitary. Between that, this you can use to reduce the dizziness.
Okay, sir. Yeah.
There's imbalance. This point you can use along with this your interior ear, the lobe 6.
Okay.
Okay. And along with that, dizziness main cause most of the time is liver only. Just activate the liver.
Okay, sir. Yeah.
Okay. Thank you. Yes, Purnima.
Sir, good evening.
Good
So
evening.
I wanted to know where, for sedating or for tonification, we use the same seed points, ear seed.
Same. Ear sedation tonification concept is not there. Just we are activating that.
Okay, so if we use it for the Shenmen or for Sengio, it is the same seed we are using.
Same seed, the auricular seed you can use.
Yes, sir. We have it, sir.
Thank you.
Right. Thank you, sir. Thank you so much.
Yes, Fauzia. Hello. Anish.
Sir, uh, I want to ask about the
Your voice is disturbing.
Sharmishta. Premalita.
Sir, what's the use of top point?
Which one?
Top.
Can you name once again?
Ear apex.
Ear effects. This is for allergy.
For allergy. And
Yeah.
there is any common point, sir? So for all the diseases, it can be used.
Commonly, we are using all primary points. That's what I given here.
Now, so many points searching and it will be troubled for the common people. So if common point is there, we can use that.
Then common point means you have to go with the all 12 major organ points.
Okay.
Where you are feeling pain, that organ you can do. Pain means any disorders. For example, urinary disorders, you can go with UB and kidney. Digestive disorder, you can go with spleen and stomach. Breathing disorder, directly you can go with the lungs and as well as top asthma point. Like that.
Okay, sir. Thank you, sir.
Sir, any point for treating cranial nerves?
For?
Cranial nerves, vagus nerve.
Vagus nerve.
Yes, sir.
Vagus nerve is connected with the brain and stomach. So activate the brain stem and stomach point.
Okay, sir.
Okay, thank you.
Thank you.
Yes, Vaishali.
Hello.
Hello, madam.
नमस्ते सर।
नमस्कार।
ये जो पेरिकार्डियम है उसको कैसा ट्रीट करना सर?
So if the patient is suffering with chest congestion, breathlessness, and heaviness in the chest, that time you can treat the pericardium.
नहीं, लेकिन वो सर्कल है, बड़ा सर्कल है, उसे कैसे ट्रीट करना?
You have to just with Sujoka Jimmy, you have to find out where exactly the sensitive point.
Okay.
You can use 1 or 2 seats. Where is the pain?
Okay, sir.
Thank you.
Thank you, sir.
Yes, Pawan.
Good evening, sir. Sir, will auricular module be activated in Nadiswara?
Yeah, upcoming already we are designing, so it will be added.
All right. We'll have to buy the license for that, or will it be in built?
If you are already having Nadiswara, for that we are updating.
All right. Thank you.
Only thing is this time we are also doing for iOS. So overall having iOS also they can use Nadiswara.
Excellent.
Okay, thank
you.
Yes, Jogi.
Yes, namaste, sir. I was using the seeds for a long time and I got a very good results. But now I came to know about the energy balancing, and I think that will help better.
TM student.
No, I am not. Yes, I am. I joined the course this year.
Yeah, all the best. Thank you.
Okay, thank you.
So anybody using single point seeds? Single point TM. Anybody can share your experience. To change single point, you can use this. If you put wrong also, you are not getting results. That's it. Nothing will happen in auricular. Yes, Satyasahili.
Sir, how are you, sir?
I'm fine. How are you?
Yes, sir. I'm fine, sir. Sir, I'm having a small doubt. Sir,
Yes.
if you have any skin changes or any nodules on the ear, external ear, it represents something about our internal issues, sir?
Definitely, exactly it correlates the reflex. Okay, where exactly the nodal is respect to that, you have to treat that organ also. Okay. Thank you. Yes, Ruchi.
Yes, sir. Hello.
Hello.
Yes, sir. My question is firstly, if lumbar is there, lumbar problem, so do we have to
Lumbar.
count 3 or 4? If problem is in lumbar 3 or 4, so is it taken as common whole as a lumbar, or number 3 pe we will be counting like we do it in our hands?
No, just in the lumbar reflex, you just using auricular Jimmy, Sujoko Jimmy, check where exactly you are feeling pain.
Okay,
Okay.
but we don't have to count it.
No need to count. Just here, just check it out. The painful point. It may be 2 or 3 points will be there. Just press that. Just apply the auricular seat. Along with that, you can also activate the kidney, which controls the lumbar area.
Yes, sir.
Okay.
The second, yes, sir. One more doubt, sir.
Yes.
So for cholesterol, heart point will be taken.
Yeah.
How to treat for cholesterol?
For cholesterol, you have to treat liver, not the heart.
Okay. Yes, sir.
Yeah, use liver and 0.0.
Liver and
0.0.
0 point. Okay. Okay.
0 point. Okay. Thank you.
Thank you, sir.
Thank you. Yes, Anushree.
Sir, I don't remember things.
You don't remember things.
Yes, matlab, what you teach, I don't remember. So how to, I want to do the TEM course, but I don't remember things. So what should I do?
Okay. First, whenever you are attending class, you have to apply 3 colors.
Tell me.
Left hand index finger below the nail, you have to apply sky blue.
Should I write it?
Yeah. You want to understand better?
Yes. Now, please tell, sir. Index finger.
Huh?
Which hand? Which hand index finger?
Left hand index finger, sky blue. And
Left
right hand ring finger, yellow.
Left hand. Sky blue. Sky blue.
Right hand ring finger, yellow.
Yang brain. Yang brain.
All are yang brain only. Right hand ring finger is yellow. And
Right hand ring finger.
yellow.
Slowly. Right. Slowly. Ring finger. Yellow.
Right small finger, purple.
Right small finger. Purple.
Okay. You just apply these colors and attend the class. You can understand better.
And sir, how do I know the combination of like you said na ki, you have to treat on the if you treat lumbar area you have to treat on that. If you want to treat The combination of.
That combination you learn with the TM course.
Okay.
There in detail you are discussing.
Okay.
Okay, fine. Thank you.
Thank you.
Yes, Vana, you want to share?
Hi, sir.
Hi.
Yes, I want to share one of my client is a boy 7 years old suffering from bedwetting. I gave Sujok treatment, but I had a little result. But after GB 40 sedation, the bedwetting is stopped completely.
You switch on video.
Excuse me?
Start your video.
Yes, sir.
This man you did with 1 point.
Yes, 1 point treatment for bedwetting. Boy 7 years old. And after 1 point treatment, the bedwetting is completely stopped.
So thank you for your feedback. So
Thank you, sir. Thank you.
Our TM class. Continue your journey of healing with single point. And
thank you, sir.
I will welcome you back for new batch also.
Thank you, sir. Can I ask something? I have one case, woman with continuously herpes in nose, fluctuating herpes in nose, and candida infection in inner genitals. I don't know. I think is nose is a lung problem, humidity on lung. I don't know. I try with Sujok, but the problem is fluctuating and coming recurrently.
Don't worry, just sedate liver too.
Okay, thank you, sir. Thank you.
That will give you the great result.
Thank you, sir.
Thank you. So all the best for all new join TM students. So definitely you can do wonders with a single point. Yes, Amit, you did so many things. Video. Visible? Yeah, tell me what how is your journey of TM? Great, all the best. So hardly you are doing magics within 30 points itself, I think. All the best, Amit. So and continue your learning also. Thank you. Yes, anybody want to share? Kala?
Namaste, sir.
Namaskara.
I just want to, I'm a new student. I started attending your class from Auricular Therapy.
Okay.
And I just want to know for chronic snoring, diabetes, and some rashes in my hand, some black it is.
Okay. First, for skin allergy, you can activate Apex.
Okay.
Ear Apex. For snoring, you can apply right hand, small finger, dark blue in the first line.
Okay.
Then diabetes.
Yeah.
So, diabetes just treat based on your symptoms and pulse.
Okay.
Because it varies. It may be involvement of the liver and as well as pancreas and spleen also. Just check what all the things involved. One general thing is you can use pancreas point. But along with pancreas, whether you are using liver or spleen or kidney, it depends on the other symptoms. Okay. Thank you.
Thank you. Very kind of you, sir. God bless you.
Yes, Sri.
Sir, I have a question. Like you said, there are nodules or bumps. Can we put seed over that bumps?
Yeah,
Is
why
it
not?
safe?
You can do it.
And also the painful areas also.
Exactly.
Thank you.
Just treat the respective organ also.
Okay.
Okay.
Thank you.
Thank you.
Thanks.
Yes. Diane and Mukal.
Hello, sir.
Hello, you
After operation of glaucoma, after operation glaucoma is workable by this point, which you have told. I 15 and liver.
Yes. So
we can apply. We can do this treatment after operation.
yeah, you can do. So operation is not at all permanent solution.
Thank you,
Operation
sir.
also it will reoccur. Instead of that, you do activate vision 1, vision 2, and low 5 for the eyes and liver. That's it. And also activate the cervical, which is connecting the eyes. Okay.
Thank you, sir.
Thank you. Vinit Saxena.
Yeah, good evening, sir. I just want to know the reason for the excessive hair fall and the treatment for the hair fall.
Hair fall happens with only two reasons. One, blood deficiency. Another one is excess stomach heat.
Okay.
Okay. So for that, one common point which you can use is spleen and Shenman.
Right, sir.
Okay. Thank you.
Freedom.
Hello.
Hello.
I want to ask for the points in the ears. Is there anyone behind the ears or no?
Yeah, we are using very few points for the behind the ears because it's rarely used. That's what we didn't check must. In the advanced class, we cover those things. Okay. So similarly, spinal reflex, we can use some vagus root point we use for the digestive disorders. For the upper back points, we use these spinal reflex areas and all. So we use that, but very rarely. But most of the things we use the points which we are given here. 12 major organs, chakras, primary and secondary master points is enough. Okay.
Okay, and for the meridians, is there any meridians chart for the ears as the one you have?
If you go with the Chinese auricular, there is a meridians, but there again, instead of that, it's better to go with the ear reflex. It's quite effective and simple.
Thank you.
Thank you. In the advanced level, we teach meridians and few more points, but for this, it's enough for in basics. Okay.
Okay.
Thank you.
Thank you.
This is to improve the vision. The eyes is controlled by liver. That's what liver point is controlled. Liver and lobe 5 and vision 1, vision 2 point. Clear? This you can use for myopia. And some simple ear exercises also works wonderful. For diabetes, kidney, stomach, lungs, endocrine, and Shenman. All these things you can use. Okay. Again, diabetes treatment, it changes based on the patient feedback and symptoms also. Yes, Anand, Yoga Mandir Ayurveda.
Sir, what is the difference between meridians and reflex points?
Reflex points directly you are taking the whole body reflex into ear and we are treating. Meridians means again how we are taking in the body meridians and Sujok meridians. Similarly, we take meridians in the ear. So with respect to auricular therapy, better go with the meridian only. This ear reflex only. Okay.
Okay, thank you, sir.
Yeah, for diabetes, again, I'm telling you, all the organs are involved in diabetes. So treatment varies patient to patient and their body constitution and the feedback from the patient after 1 or 2 sittings. So what you learned here, carefully apply that. For dry cough, just liver and lungs along with the adrenal gland you activate. This tragus 3. It clears your dry cough. For kidney stones, just activate stomach and kidney, both. Both are responsible for kidney stones. Dandruff, use Shenman, brainstem, and kidney. To increase height, you have to apply seed for lumbar and as well as 0 point and sacral, cervical. This is to quit the smoking and insomnia. This is the anxiety, fatigue, gastritis. See this, to reduce all excess, we are using the Shenman. So menopause, we are using kidney, uterus point, and Shenman, endocrine. Clear? So, like palm and foot, ear is another tool for you, but that you should implement with the concept of TM. By just treating only reflex, you will get the relief. Knee pain. You treat the knee joint, you get the relief. The moment you remove the auricular seat, again the knee pain happens. To get permanent solution, so knee is controlled by liver and kidney. There are also different concepts is there. There is a fluid deficiency or ligament weakness or right knee or left knee. It's unable to bend, unable to walk. So you have to take so many criteria for one knee pain. So you can learn all those criteria in upcoming TM course. So you can join the TM course, which is going to start soon. And along with the single point, which we are treating most effectively, as a few of the students, they shared wonderful results. You can also use these auricular concept into that. In upcoming TM course, again, we are going auricular little deeper side, because there you already learned the concept of meridians and points. There we can correlate much better. Okay, so all the best and see you soon in upcoming TM course. Here, any of the participants want to share your experience of your TM treatment, because since 2 years we did 4 batches in the Joshi's Keda group in 2.5 years. So any of you want to share your experience. So how is your practice before attending TM course and now after attending TM course? It will be helpful for us to enhance and to upgrade our course and to join the course and all. Anybody wants to share voluntarily, please welcome. Just share your case studies, nothing else. This is the platform to share what miracles you did and what protocols and what points you used to treat the patients and how they got wonderful results. Yes, Anand, you can, if you want, you can start video.
Sir, after doing your TEM course before 2 years, now in my practice, I enhance my diagnosis power by checking pulse and tongue and eye. So many patients now I can give relief. I ask from you by without seeds, can I practice any other? So you have said there are so many therapies, but diagnosis first. So after doing TEM course, I have upgrade my diagnosis. So many now treatment is easy and relief very better results, sir. Thank you all of you, sir. Because of you.
Thank you very much. So from Anand perspective, he improved the diagnosis skills. Of course, if you are concluding one point to treat means definitely accurate diagnosis. So congratulations for adopting this TM and practicing and giving wonderful results to the people. Thank you, sir.
Thank you, sir.
Yes, anybody? Yes, Subodh.
ನಮಸ್ತೆ ಸರ್.
ನಮಸ್ಕಾರ, ಎಲ್ಲಿದ್ದೀರಾ? ಒಂದು ನಿಮಿಷ.